Hello, friends, and welcome to Pediatric Flow. I'm Jolene, a doctor prepared, dual board certified pediatric nurse practitioner, and I'm so glad you're here today. Today, I want to talk about advocacy, not the loud, dramatic kind, but the quiet, steady kind, the kind that starts with listening. In pediatric healthcare, parents know their child. They may not know all the medical terminology, and they may not know lab values, and they may not understand the imaging, but they do know when something isn't right. This is their child. And sometimes in busy systems, in fast moving environments, and when everyone is trying to be efficient and reassuring, that voice can get minimized. Not intentionally and not maliciously, but just system momentum. But advocacy begins when someone slows down enough to say, "Tell me more." Real advocacy is not about proving someone wrong. It's about being willing to pause for just a second and saying, "Let's talk about this." To reevaluate, to reassess, and to ask one more question and to look one more time. Because sometimes the difference between everything is fine and we need to act is simply that someone chose to listen. Advocacy requires courage. It requires the willingness to say, "I know we've already evaluated this, but something still isn't sitting right." That's not defiance as providers or as parents. That's professionalism. And strong clinicians know that we are not the ones who are always certain. They're the ones who are willing to reconsider. Just as strong leaders create environments where questioning is safe, where parents are heard, where nurses are heard, where advanced practice providers are heard, and where residents are heard. Because medicine is not about ego, it's about outcomes. And for me, advocacy is not new. My entire career, almost 3 decades, has been built on doing what is best for my patients and their families. And I understand deeply what it feels like when there's pushback, when a diagnosis feels unsettled, when a plan feels undecided, or maybe decided, when the system feels like it's already moving forward. Advocacy in those moments can be very hard. It can feel uncomfortable, and it can feel isolating, and it can feel like you're standing alone. But I have never been someone who shies away from what's hard and difficult. I look at that child in front of me, and I know I'm doing the right thing. I trust my physical exam. I trust the training and experience that comes from doing this work for so many years. And I trust families and my patients when they tell me something isn't right. You may not always have the answer, and you may not always know exactly what the diagnosis is. But when something doesn't sit right, that matters. Because of perseverance and advocacy, over and over and over again, across many years in healthcare, I have seen outcomes change. I have seen lives be impacted. I have seen the change. Not because I was the loudest voice in the room, but because I was willing to listen and not give up. Because I really wanted to make a difference for that family and that child. To reassess again, to speak again, and to act. So I encourage you, whether you are a parent, a provider, a nurse, or a colleague, Trust yourself when you're advocating. You may not know the solution yet, but you can know when something deserves another look. Parents, your voice matters. My colleagues, your voice matters. And most importantly of all, to the children that we care for on a daily basis, your voice matters most of all. And as always, the world needs your compassion, your courage, and your light. And until next time, keep shining.